Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us, both from Tummy Temple, we have Heidi Ochsner, registered dietitian, and we have Dr. Jennea Wood, naturopathic doctor. And they have a really important topic to speak with us tonight. Get your spark back, the hidden causes of thyroid disorders. Thank you so much, ladies, for joining us. It's always a pleasure.
Thank you, Elizabeth.
Thanks,
So nice
Elizabeth.
to be back. I'm Dr. Jennea Wood, and thyroid disorders are one of the most common things I see in my practice. I practice with Tummy Temple out of our Lacey location, but I do a lot of telemedicine. So, I can help people who are not in that area. So I love to teach this class because thyroid disorders are so common. I really am teaching this from a place of wanting to just offer support to as many people as possible and help people get their energy back, help people find resources to be able to advocate for themselves and find the right testing, ask their providers for the right testing, and then reach out and get support from a more holistic perspective if that is what you need. So with that said, let's get started. Please do stop and shout out questions. You can either post them in the chat or you can unmute yourself and ask a question during the course. So please don't hesitate. I want this to be as useful to you as possible. So a little bit of background, hypothyroidism or low thyroid function is so common. It affects at least 17 million Americans are diagnosed, and then an estimated 13 million Americans, or maybe up to another 17 million Americans are have low thyroid function but are not properly diagnosed yet. And up to 95% of those people in this country with low thyroid function have Hashimoto's thyroiditis, which is an autoimmune disease affecting the thyroid gland. We will talk a little bit about Graves' disease, which is much less common, but is an autoimmune disease causing too much thyroid function, but we won't go as in depth into that today. And thyroid disease disproportionately affects women. Way more women than men end up with this condition, and approximately 1 in 8 women will develop a thyroid disorder during her lifetime. So really worth knowing about and knowing where you can start looking for ways to recover. So I want to go a little bit into the roles of the thyroid gland. It's a small butterfly-shaped gland located at the base of the throat, and it produces 2 hormones. One of them is called thyroxine, also known as T4, and then the other one is called triiodothyronine, also known as T3. And those are released into the bloodstream where they travel throughout the body and are taken up by every single cell in the entire body and affect just about everything. Thyroid hormones play a direct role in the health and normal functioning of the brain, the gut, the heart, the bones, the blood, the liver, gallbladder, hormone production, blood sugar balance, cholesterol metabolism, protein metabolism, and body temperature. So really wide-ranging effects. And some of the symptoms of thyroid disorders kind of it helps make sense out of this if you think of it as the thermostat of the body. So if you turn up the thermostat, what would happen? You would be overheated, you would be sweating, you would be jittery and anxious, which would likely lead to insomnia. You would probably lose some weight because your metabolism would be going so much faster. Your digestive system would move faster, causing diarrhea. Your heart would move faster, causing racing heart or palpitations. And then long-term, your bone turnover cranks up, which can lead to osteoporosis. So then with hypothyroidism or low thyroid function, that would be akin to turning the thermostat down. And so you would be tired, cold, constipated. Unfortunately, still sometimes trouble sleeping, sluggish, easy weight gain. The hair wouldn't be growing as robustly, and there's often hair loss. The skin would be dry and kind of thickened oftentimes. And then the brain doesn't work as sharply, so there's a lot of brain fog. And then along with the inflammation that goes along with hypothyroidism, people can have achy muscles and joints, and there's just kind of less juiciness, less repair of the body. And so that's part of that achiness and joint pain. The main type, or the most common type of thyroid disorder, as I mentioned, is Hashimoto's. And at its root, this is actually a disease of the immune system, not of the thyroid, but it's primarily affecting the thyroid. So this is the most common condition in the United States, as opposed to some places where there's too little iodine. And in those places, the more common cause would be iodine deficiency. So it's an autoimmune disease where the immune system is producing antibodies that tag thyroid cells for destruction. So there are usually other problems going on concurrently that are playing into this cycle. This is why the immune system is acting up, and we'll get into this more in a moment. And early in the disease, because the thyroid cells are being destroyed, as they're damaged, they can actually release more thyroid hormone. And so sometimes people can kind of swing back and forth between excess thyroid symptoms and deficient thyroid symptoms. But usually later on, well, inevitably later on in the course of the disease, you just swing toward too little thyroid function. And so more toward that hypothyroid or low thermostat setting picture. So everybody's probably aware that conventionally in conventional medicine, thyroid conditions are treated by just replacing the lost thyroid hormone generally for the rest of your life, and that's just kind of the end of it. From a naturopathic perspective, I would be replacing the lost hormone and also working to identify the reasons why the immune system is damaging the thyroid gland in the first place, and then seeking to remove or shift those root causes. So this often includes improving digestion and absorption of our foods, correcting nutrient deficiencies, supporting stress response, hormone balance, etc. And we'll go into more detail on a lot of those. So using this approach, I really have very frequently seen that it's possible to stop any further destruction of the thyroid gland. And then sometimes you can actually regain some of that lost function, or just get the body working in a way where the other organ systems that support thyroid function are humming along so well that people can sometimes reduce how much hormone they need to take, or potentially even get off of it. It's not my goal going into treating someone to just the end goal is not take everybody off of their thyroid hormone. I think it's a reasonable thing and a safe thing to take thyroid hormone, and it's so important if you need it. But that is sometimes a beneficial side effect of this type of root cause approach, that sometimes you don't need as much. Graves' disease, like I mentioned, much less common, is also a disease of the immune system, not technically of the thyroid gland, but it's manifesting in the thyroid. And so this is another autoimmune disease where the immune system is producing antibodies that, instead of tagging thyroid cells for destruction, is actually stimulating the thyroid gland to make more thyroid hormone. So this can actually be a lot more harmful and difficult to treat, because the effects of getting too much thyroid hormone are more dangerous. Conventionally, it's treated by using medications to suppress thyroid function, or if things are really out of control, removing the thyroid or using radiation to destroy the thyroid gland, and then just giving the person thyroid hormone replacement for the rest of their life. So a lot of the things that we're talking about today, while the class is more skewed toward hypothyroidism because it's so much more common, a lot of these root causes will benefit and will be part of the root causes of Graves' disease as well. So certainly pertinent if that's your situation. And then, of course, it is possible to have non-autoimmune hypothyroidism. And there can be a number of different causes of that, and we'll discuss some of those today. That can include nutrient deficiencies. It can include environmental toxicant exposure. So those are some of the things, and those can also affect Hashimoto's. We'll be going into that later. So first of all, if you don't already know, it's important to tell if you have a thyroid problem. And generally, naturopathic doctors tend to do more in-depth testing than what is done conventionally. And that's because it is totally possible and happens all the time that a thyroid issue is missed by doing the kind of surface testing. So the most common testing that's done with your average primary care physician is TSH. And then sometimes they will also test free T4. And that's almost always it. The problem with that is that the most active thyroid hormone is free T3. And our bodies make primarily T4. And then out in the cells, when the thyroid hormone is circulating, the cells take up the T4 and do a large quantity of the converting of T4 into our most active thyroid hormone that makes us feel the best inside the cells. And so, and then the rest of it, we make a little bit of T3 in the thyroid and that's circulating. And then our liver actually does a lot of converting of T4 to T3. And so if we don't check that, sometimes conversion is the primary issue, and the person has the TSH is pretty good, the free T4 is pretty good, but if you actually check some of these other tests, you'll find that there is an issue. So free T3 is one of them. That's, like I said, the hormone that makes us feel good, that does the lion's share of the work of all of those functions in the body, affecting the digestion, affecting bone turnover, affecting brain health, all of that. That's basically all T3. We just start out with T4 because it's less active and actually helpful to kind of distribute it in a less active form, and then the conversion happens kind of on site. TSH is a signal from the brain telling the thyroid whether or not there's enough hormone being circulated. And so it's a feedback mechanism. So if your TSH is too high, that's your brain telling your thyroid there's not enough thyroid hormone around and that it should go ahead and make some more. When TSH is too low, that means that there's too much thyroid hormone present and your brain is saying, we don't need any more. I'm not going to send the signal for more TSH or for more thyroid hormone to be made. And then a final test, or there's a couple more tests to go over. Another test that I find really useful, I don't always run this right off the bat, sometimes just based on insurance coverage, but it is really, really useful, is reverse T3. So reverse T3 is an inactive storage form of thyroid hormone. So when your body is under a lot of stress, and it can be just, psychological stress, or is experiencing stress of a different form, inflammation, then our T4 gets converted to reverse T3 in order to conserve energy. So essentially our body is saying, hey, there's a lot going on right now, whether it's high stress at work or in family life, et cetera, or whether it's some out of control inflammation process. We really need to conserve our resources, make sure we can get through this. let's turn down the thermostat for now to just get by. So that's what's happening when reverse T3 is elevated. And, you know, it is not uncommon for me to run this test and find that all of the other numbers look perfect and reverse T3 is really high, and that, you know, there is a thyroid issue going on there. This person is not getting enough thyroid activity, and that's one of the reasons why they feel crummy, why they have brain fog, why they have low energy. So really a useful test. Sometimes I run it right off the bat, depending on the person's situation. And then sometimes I run it as a follow-up if we're just, the initial panel looks fine, but we're still trying to figure out why the person isn't getting better. And then the final two tests that I run just generally off the bat on everybody are the two thyroid antibody tests that tell us whether Hashimoto's is present. So those are anti-TPO antibodies and anti-TG or thyroglobulin antibodies. So those are what signals that Hashimoto's is the issue versus non-autoimmune thyroid hypothyroidism. So those are the tests that I would ask for from my doctor if, you know, if you're looking for more in-depth investigation. And if they won't run it for you, you can order these yourself. There are starting to be, you know, there's really more and more access for people to order their own labs. So direct labs is generally the place that I send people. So if you're, you know, far away and can't find anyone who will order this for you, I'm not able to, you know, I can consult with people in other states, but I'm not able to order labs in other states. But I will just coach people through ordering their own labs in that situation. So you can
Dr.
order.
Wood,
Yes.
wouldn't you say that as well, another good reason to have a naturopath look at your labs is that naturopaths sometimes look at the numbers differently than a regular primary care physician who might say, oh, your TSH looks fine to me. And then a naturopath might be like, I actually think that optimal would be in this much tighter range. And so you might have had a test done and had a doctor say, no, it looks fine. But then you bring it to a naturopathic doctor and go, I actually don't think those numbers are optimal. And that explains a lot of your symptoms.
Absolutely. Thanks for mentioning that, Heidi. Yes, yeah, the range with lab ranges, a lot of times the lab changes the range over time based on what's sort of average for the population, which is not a good way to set hormone ranges. Because if, you know, a group of people are getting sicker over time, you're going to end up with a wider and wider lab range, which really happens with environmental exposures to more and more toxins and, you know, with our stressful lives that are getting getting crazier sometimes. So yes, absolutely, it's worth having a naturopathic doctor take a look at your labs, even if you've been told that they are normal. So, and then if the person is having symptoms of excess thyroid hormone, then I will also run thyroid stimulating immunoglobulin or TSI, and that's the antibody that signals the presence of Graves' disease. So because the most common cause of low thyroid function in this country is an autoimmune disorder, I want to go into a little bit more detail on autoimmune diseases in general. And some of the things we're going to talk about today apply really to any autoimmune disease. And there are, you know, some things that vary from one to another, but a lot of them apply generally. So in an autoimmune disease, the immune system gets flared up by something or somethings, and a small band of immune cells start producing antibodies that tag cells for destruction. So in this case, that's thyroid cells. Once tagged with antibodies, there are other immune cells that kind of move in and begin doing the actual damage. So with any autoimmune disease, I kind of look at it as like a stool. So the condition is being supported and perpetuated by a number of different factors. I used to say a three-legged stool, but there's just more and more evidence that a history of trauma or adverse experiences early in life plays such a huge role in autoimmune diseases. So now we talk about it as a four-legged stool. So, so that analogy is helpful because you can think of, if you remove two of the legs of a four-legged stool, the stool can't stand up anymore. And so that's the point at which you can stop an autoimmune process from happening. So the four legs are the right genes. So if you have no genetic susceptibility for a particular autoimmune disease, it's just highly unlikely that you will develop that autoimmune disease. So you kind of have to have particular genes that would be distinct for different autoimmune conditions. History of trauma or adverse experiences early in life. And then there has to be a trigger, and that's often an infection of some sort, can be all sorts of different infections, but it can be exposure to toxins as well, mold toxins or, man-made chemicals, or other types of toxins. And then there has to be intestinal permeability. So there has to be leaky gut going on, and this revs up inflammation in the body. So two of these things are sort of out of our control. We can't affect, we can't change our genes, although we can change their expression through lifestyle factors and addressing stress. And then we can't change what happened to us early in life, but we can kind of look at our trauma, and there are all sorts of really wonderful tools out there to help process and recover. And then, we can't change that there was a triggering event, but we can identify and remove infections or help the body detoxify toxins. And then we can heal up leaky gut. And so there are a lot of things that we can do to change this picture.
Dr. Wood, there's a question about how someone would know if they were genetically predisposed.
That is a great question. It really depends on the autoimmune disease. So, I don't know off the top of my head if I don't think there has been an individual gene identified linked to Hashimoto's. I could be wrong on that. I'm not sure, but I know there is for example, celiac disease, and for a number of other conditions. So you can get your genome sequenced, and there are certain genes that are associated with certain autoimmune conditions. But just in general, we know that different autoimmune diseases have major ties with certain genetics. And there seems to be a thing called molecular mimicry going on there, where if your cells look a certain way, it can make it more likely that your immune disease will kind of mistake it for a certain infection. So then if you get that infection, it'll kind of tip your immune system into attacking those cells. So I don't know if or what gene particularly would play a role in Hashimoto's, but there's definitely a genetic susceptibility there where not everybody is, it tends to run in families. So not everybody is going to be susceptible to this autoimmune type of low thyroid function. Okay, so getting into root causes. So just a huge general basket one is inflammation from any source. So we're going to kind of break that down and talk through some of the different ones. And the reason this is a problem is because A, it promotes conversion of T4 to that inactive reverse T3, and B, it promotes increased immune activity that causes collateral damage to the thyroid. So one major cause of chronic inflammation is leaky gut. And so this is where the lining of the intestines is supposed to act as a selective barrier between the food you eat, your gut bacteria, and the rest of your body. And when this barrier gets damaged, bits of protein from your food and bits of bacteria are allowed to leak into the bloodstream. And your immune system really doesn't like finding non-self things in the bloodstream. So the immune system starts to react a bit like it would in the early stages of a blood infection by producing inflammatory chemicals and really trying to fight the infection. It's not really an infection, and it just kind of keeps going on and on as long as the leaky gut continues. And so there's just this long, low level kind of battle happening of the immune system responding to this threat or perceived threat, and therefore just kicking up inflammation. A lot of the factors that we're going to talk about are that cause inflammation do this at least in part by irritating and inflaming the lining of the intestines. So, there are some chemicals that may do other inflammatory things in the body, but they also damage the intestinal lining. And there are some infections that we'll talk about that might, get in other places in the body and cause problems there, but they also damage the lining of the intestines. Same with stress. Stress has all sorts of effects in the body, not just in the gut, but it also irritates and inflames the lining of the intestines. So this is a huge piece. And please, if you want to learn more in depth about this topic, check out our class on leaky gut. And I'm going to send out a follow-up email after this class. It'll probably be tomorrow, but I will provide a link to that class if you want to check that out, because this is a huge topic. It deserves more in-depth discussion if you really want to understand and learn about it. And it's more than we can cover in this class.
That was perfect timing because we just did have a question. Someone said, how do we know if we have a leaky gut? And so this class on leaky gut will give you that answer and more. And a very short answer would be if you had a lot of food sensitivities, that would be one clue that you might have leaky gut. And there is one other question that's a bit more specific, Dr. Wood. Mm-hmm. And it says, do you have any experience with the Tyrosint, Tyrosint brand T4? This person's back on Synthroid after having a negative reaction to Armour Thyroid, but they're looking for a sugar starch-free option for their T4 because they have SIBO. Yes.
I don't think I've ever used that one. I have used some of the other name brand versions of levothyroxine. And, there are different fillers, different binders in kind of the different versions. I believe the generic levothyroxine is gluten-free, but I know I would double check on that. I'm not entirely sure, but sometimes one just works a little bit better than the other. So, I think that's reasonable to try, but I haven't worked with that one, so I can't really answer to that.
Thank you.
So the basic concept with leaky gut or with recovering from leaky gut is to find out what's bothering it, whether that is certain foods, exposure to chemicals, stress, etc. Address those things and then help your body digest foods more completely. And so sometimes, people will have low stomach acid or not produce enough digestive enzymes. And so sometimes it actually really helps to add in some extra digestive factors to sort of build up the digestive fire, help you completely digest foods, because if you're not fully breaking the food down, it just sort of sits around, goes bad a little bit, breeds excess bacteria in places that they shouldn't be, causes more leaky gut. So we really want to be chewing our food thoroughly and making sure we're digesting it fully. So the thing that we often use, or the product that we often use, is Temple Total Digest, which is a nice combination of a little bit of extra stomach acid, extra digestive enzymes, and extra bile support. So that's a nice one. Once we're digesting our foods fully, or alongside that, we also want to use some soothing, healing herbs to help kind of act as a Band-Aid, heal everything back up. So we often use Intesta-Heal for that, or L-glutamine. But much bigger topic, definitely dig in more on that, watch the other class, or, seek out some support with that. The next root cause that we're going to go into is stress and adrenal dysfunction. So the adrenals are two little glands that sit like caps on top of our kidneys. So they're kind of deep in our back area, under the rib cage. And they make up another really crucial part of our hormone systems. They work in close concert with the thyroid gland to allow you to have energy and respond to stress appropriately. The adrenals really are your stress response system. So they produce adrenaline, or also known as epinephrine, in acutely stressful situations that give you that shock of energy that makes your heart race and kind of helps you respond in intense situations. And then they also produce the slow burning stress hormone cortisol. So cortisol is released every morning to help us wake up, to balance inflammation. It's actually our innate steroid that tamps down inflammation. And so we really need it around, but we need it to behave in a steady, normal fashion. If it starts to be pumped out in excess amounts or in wonky patterns when someone has been under chronic stress, or when it drops too low, that can start to cause problems. So you can think of the adrenal glands and their hormones as providing kind of a stable ground for your thyroid to stand on. So if the adrenals are not working well, the thyroid has to work harder to try and compensate and will be more seriously affected. So I've frequently seen my hypothyroid patients actually decrease the thyroid hormone that they need to take when their adrenals are working better. And also, when you're under a lot of stress and have high levels of cortisol present, your body takes this as a sign, like I was saying, to conserve resources, and therefore the T4 hormone gets converted into reverse T3. And so that's another reason why the thyroid hormone just doesn't work as well when we're under a lot of stress.
I have a quick question.
Mm-hmm.
Hi.
Hi, go ahead.
So this is like new information to me about the low thyroid potentially being linked to like autoimmune sorry, not well, it is autoimmune disease, but you said like an immune system issue versus like I just always had it explained to me that it's like what you're talking about now with the adrenals, like period. That's like the cause. So I'm trying to understand the two parts of what you're saying, like the adrenals, is that what's potentially causing low thyroid? How does like the like immune system attacking itself factor in? I'm a little confused.
Yeah, so there are multiple different things that can be happening. And so it actually is different for different people. And that's part of the, the investigation part. That's part of why you might want to work with someone, because it's not the same for everybody. So the autoimmune part is generally, at least on the surface, separate from the adrenal part. Adrenal dysfunction and stress can certainly flare up the issue where the immune system is attacking the thyroid, but they're kind of two separate processes. But then when the adrenals aren't working well, the thyroid hormone that's present won't help you feel as energized as it would. They kind of you need both to really feel good. And the thyroid hormone is just more effective if your adrenals are also working well. And then, totally separate from the autoimmune issue, when you're really stressed out, then your body will start shunting some of the thyroid hormone that you are making into this inactive storage form. And that has nothing to do with the autoimmune issue. That's a response to stress. So yeah, there are just a number of different things that can be going on, and not everybody has that shunting issue going on. That would be where you check the reverse T3, see if that, and you know, see with like if that makes sense for you, if you have a lot of stress or high inflammation, it's worth checking that, because that could be part of the picture, but it's not for everybody. Does that help?
Yeah, that's helpful. Thank you.
Okay, so it's again, there's a lot more finesse to addressing adrenal dysfunction than just supplements, but some of the tools that we do find useful are we have a formula called Daytime HPA. That's a really nice basic herbal adrenal formula. We have another one called ADB5 Plus, really unhelpful name. That also is really helpful. You never want to just rely on adrenal supplements though, because they can give you a little bit of energy and respite initially, but if you're not also addressing the reason why your adrenals are not happy, then you can end up actually crashing worse than you were before if you just take supplements but continue a lifestyle that's unsustainable, or you know, pushing yourself beyond your limits. So it's really worth getting some support with that and looking at it as a kind of a whole body approach. Nerve tonic is another thing that I love. It's a just really calming, soothing. It's not so much an adrenal tonic, but it just kind of helps calm the nervous system when we're having stressful times. Okay, moving on to hidden infections. So in some cases, not everybody has this, but in some cases, the reason that the immune system is attacking the thyroid gland in Hashimoto's, so this is back to the autoimmune issue. Sometimes it's because there's a stealth infection hiding in and around the thyroid gland and stirring up the immune system in that area. One virus that is particularly known for doing this is called Epstein-Barr virus, or EBV. So this is kind of one of the theories of autoimmunity, that maybe the immune system is not confused. Maybe it's doing its job effectively and trying to eradicate the infection, but unfortunately there's some collateral damage happening. So I think this is often the case in a lot of autoimmune conditions. So Epstein-Barr virus is the virus that causes mono or mononucleosis, and it's of a family of viruses that just one of the things about them is that once you have that virus, it sticks around forever. However, if you have a healthy, functional immune system, the virus goes into dormancy, your immune system just kind of keeps it locked away and it doesn't cause trouble. However, if the immune system takes a hit or is really struggling, the virus can come back out of dormancy and start to cause problems again. And the thyroid is one of the more common systems that can be affected. I actually have seen this so frequently in the past couple of years. After having COVID, people frequently have reactivation of Epstein-Barr virus, and then it just really causes a lot of problems, a lot of fatigue, sometimes night sweats. So if you're struggling with kind of a flare of symptoms since COVID, that's a really useful thing to look into. And there's a panel of antibody tests that I order to look at that. And then there are other types of infections that can cause problems for the thyroid as well, including parasites of all kinds, fungal overgrowth like Candida, and then small intestine bacterial overgrowth. And again, we don't have time to go into great detail on these things. I believe we have a class on our website on Candida and yeast overgrowth. So if you want to check that out, that could be a useful next thing to look into. And then this is really a reason to schedule an appointment with myself or one of our other naturopathic doctors to dig deeper, because we have really great testing to investigate for these things and really find hidden infections if they're present. Environmental toxicity is the next topic. And so a couple of the biggies here are halogens, which are elements in the periodic table that are in the same row as iodine, or in the same column as iodine, and then heavy metals. So there are a lot of different types of environmental pollutants that can wreak havoc on the thyroid gland. Because iodine is so crucial to proper thyroid function, anything that interferes with the thyroid getting enough iodine can cause problems. So that's the problem with the halogens. They are similar enough in structure to iodine that they can, if we get exposed to a lot of them, they can kind of bump iodine out of its spot where it's being used to create thyroid hormone and really disrupt thyroid health. So these include chlorine, bromine, and fluoride. So chlorine is added to our water to help kill contaminants. So that's a really useful thing, but then we really want to filter it out before we drink the water. So highly recommend getting a really good quality water filter. And I can attach a handout to the follow-up email that I'm going to send out with some recommendations there. Depending on your city, some cities use chlorine, some cities use chloramine. Certain filters filter chlorine, but not chloramine. So it bears attention choosing a good water filter. And then bromine is actually added to a lot of breads as a dough conditioner. So that's one of the main places that people get exposed to that. And then fluoride gets added to water, not in every city, but in a lot of cities. And that also needs to be, I believe it should be filtered back out, especially if you have a thyroid issue, because it can really disrupt thyroid health. And then heavy metals can also seriously interfere with thyroid function. Other toxins would include mold, formaldehyde. Some of the chemicals found in breast implants can mess with the thyroid. And so, it really depends on what the source of exposure is, what the best way is to help detoxify it. So that's another reason to kind of get more detailed support through a consult. We do have a cleanse program that I find to be really beneficial in general. And then it's one of the things that I've seen get people to a place where they need to actually lower their thyroid hormone dose, in part because of this, because your body will be detoxifying some of the chemicals that are kind of dragging down thyroid function. And in part because when the liver works better, it can do better conversion of T4 to T3. And so we'll actually have more T3 around and we'll get more benefit from the thyroid hormone that we do have, or the thyroid hormone that we're supplementing. So supporting liver health is really, really important. So our Revive Cleanse program is wonderful for this. You can also just take some gentle ongoing liver support, like HEPA caps is a product that I often recommend for that. Or one of the things that's in the Revive Cleanse is Temple Detox Optimizer 2. And that is really wonderful, just gentle detox support for the liver as well. Okay, so we certainly do need iodine for thyroid health, and it's one of the ingredients to make thyroid hormone. However, we can actually get too much iodine. So it used to be that iodine deficiency was the main cause of thyroid disease in many countries in the world. But now, because of the way that foods are produced, processed, and manufactured, many people have actually swung the other way and now get too much iodine in their diet. So there's actually a pretty narrow therapeutic window between what's too little and what's too much. We need about 100 micrograms a day, and many people are getting way more than that. So the biggest sources are iodized salt, which gets added to processed food and restaurant food. Himalayan pink salt actually has double the iodine of iodized salt. Seaweed is a really high source. Seafood like fish and crab and oysters. Dairy is a pretty high source because the cow's udders actually get treated with iodine to kind of clean and sanitize them between milkings, so it gets into the milk. Eggs have iodine in them, commercially baked goods, multivitamins, iodine supplements, and cosmetics. There are actually a lot of body care and skincare products that have iodine added, and it absorbs really readily through the skin. So our sensitivity to iodine really varies based on genetics. So, it's a little hard to tell just by where your ancestors were from, but in general, if your ancestors grew up in an area close to the ocean, they, and this is for generation upon generation, they likely evolved more tolerance for higher iodine exposure and just kind of cope with it better. Whereas if your ancestors for many generations back were from an area where there was very little iodine available, oftentimes far from the oceans, there can be, really, the soil can be very, very low in iodine, in which case we would have evolved to actually extract every little bit and be highly sensitive to the amount of iodine. And so that's where this can really vary. And some people can kind of tolerate larger amounts and eating Himalayan pink salt and eating fish and seaweed and all of that, and other people not so much. So, sometimes this can really be a factor. Iodine can be quite inflammatory to the thyroid when we're getting too much. So sometimes thyroid function can actually be normalized solely by reducing iodine intake to the point where our body can sort of use up the excess and get back to a state of balance. If you're wanting to learn more about this topic, please check out the book called The Thyroid Reset Diet by Dr. Alan Christensen. He's done a lot of this research over the years and done a lot of research on testing foods to figure out exactly how much iodine tends to be in them, looking into the connection here. So his book is a great resource on that. Okay, so next root cause is nutrient deficiencies. So we need actually kind of a lot of specific nutrients for the thyroid to function properly. Selenium is one of the absolute most important, and selenium helps balance out any excess inflammation from getting too much iodine. So sometimes if iodine excess is part of the problem, adding in a sufficient amount of selenium will really help balance that out and reduce inflammation. It's also crucial for converting T4 to T3 out in the body. And it's a powerful antioxidant, so it just kind of protects the thyroid cells. 200 micrograms is the proper dose, and that has studies showing that alone, just taking 200 micrograms of ideally selenomethionine is the form that's most helpful. That alone can reduce thyroid antibodies as found in Hashimoto's. So that's a wonderful thing to add in, and sometimes can just really help people feel a little bit better just by itself. Iron is also very important for thyroid function and for conversion of thyroid out in the tissues to the active form. This is really individual though. I really don't recommend that just anybody go out and supplement iron. You can actually do more harm than good if you are not deficient, if you have plenty. Iron taken in excess can both feed cancer and feed infections. So it's really needs to be based on lab testing showing that you are deficient and need some iron. Zinc and copper are also very important for that peripheral conversion of T4 to T3 out in the bloodstream and the tissues. And then vitamin A, vitamin E, B vitamins, just all of the B vitamins, potassium, tyrosine. Tyrosine is an amino acid that forms the backbone of thyroid hormone. So it's one of the ingredients to actually make the hormone. And it's found in some of the thyroid support supplements out there. And then omega-3 fats are helpful as well, like fish oil. So some of the reasons we end up with nutrient deficiencies include farming practices just leading to lower mineral content in foods, food processing, which removes minerals, eating a diet high in processed foods and simple carbohydrates that just is kind of nutrient poor to begin with. Dysbiosis, so that's a general term for just the microbiome, the bacteria, fungus, parasite, etc., balance in the gut being off, or having too much yeast, having parasites present, having too many of the types of bacteria that are not so helpful for us. That's called dysbiosis. So when that's the case, we actually don't absorb our minerals as well. Low stomach acid is a major issue. So when we don't have enough stomach acid, we have a really hard time absorbing minerals. So just seeing this come back over and over again, we need those minerals for thyroid function. So the zinc, the selenium, the copper, magnesium is really important as well. Overuse of antibiotics is part of this, and that's in part because it throws off the microbiome and changes our absorption. And then it's sort of a vicious cycle, because having kind of untreated or not sufficiently treated Hashimoto's thyroiditis actually makes you less able to absorb and extract nutrients from your food. And so once you have Hashimoto's and it's not well managed yet, you often will end up with nutrient deficiencies, in part because of all the fallout from the Hashimoto's, and then those nutrient deficiencies will make the hypothyroidism worse as well. So it just kind of goes round and round. So oftentimes it really helps to kind of build up nutrition, to take extra amounts of some of these nutrients for a couple months, 3 to 6 months, to really build up your levels early on. And then you wouldn't need to take those high doses long term. Once things are more well balanced, once your thyroid is humming along more happily, you'll just be able to kind of maintain your nutrition and nutrient levels more easily.
Dr. Wood, we have a couple of questions. One is, does selenium work for Graves as well?
Oh, that's a good question. I haven't seen research on that. That doesn't mean it doesn't exist. As an antioxidant, absolutely. As far as making, you're already making too much thyroid hormone. So the conversion, I don't think, if you took 200 micrograms, it's not going to make things worse. It's not going to, cause problems for Graves' disease. And it's an important antioxidant, not just in the thyroid, everywhere in the body. So I think it would be helpful overall. I wanted to mention and forgot to mention, you can get too much selenium. It's not more is better. So getting over 600 micrograms a day, you can actually get selenium toxicity. So you want to be in that sweet spot. But I think generally it would be helpful in Graves as well. Maybe not quite as directly, but getting too much thyroid function will kind of stress the body in a way, and having plenty of antioxidants around will at least kind of help protect your cells from that stress.
And then, and then someone did mention Brazil nuts have selenium, so be careful. And what I will say about that is it also depends on the soil that they're grown in. They can have wildly different amounts of selenium depending on the soil in which they're grown. Someone did want to know what was recommended to recover from antibiotics when you were speaking about microbiome. And And then there's also a question regarding stomach acid and would it be detrimental to drink alkaline water instead of pH 7, such as a Kangen water machine?
Yeah, so Brazil nuts, I mean, I think generally are helpful. You just want to make sure you're not taking a selenium supplement and eating a big handful of Brazil nuts. Generally, if you have 4 Brazil nuts, yes, absolutely. As Heidi mentioned, it depends on the soil that they were grown in. So you don't really know exactly how much you're getting, but 4 Brazil nuts a day is safe, and you are likely to be getting somewhere in the ballpark of 200 micrograms of selenomethionine, as that is Brazil nuts do contain that optimal form of selenium, which is really nice. Just don't do both at the same time, and don't do like 12 Brazil nuts a day. How to recover from antibiotics, that's such a big topic. I wish we could go into that today, but we're getting close to the end of the class. You know, that's one of those things where I would just recommend looking at some of our other classes on gut health, coming in for a consult. So, and then stomach acid. Yes, it's a big problem to drink alkaline water with your meals. So don't do that. I am not a huge fan of Kangen water. It's not actually a very good filter. And it does some other beneficial things to the water that have some health benefits, but it's not a great filter. And then, yes, that's just a super important education piece. Drink it like stop at least 20 minutes before you start a meal. And if you need to have anything to drink, have plain water. And then don't drink it for at least an hour and a half, 2 hours after your meal, because you'll be digesting. Let's see, one more question. Always took Thyroid with breakfast and everything seemed fine, tested fine. Now there seems to be religious fervor about how and when to take it. What's the deal with empty stomach and not with tea? The not with tea is because tea has tannins in it that can bind up the hormone and make it inaccessible. And so you'll get a lower dose overall if you take your thyroid hormone with tanniny things like tea or coffee. When you take it with food, it slows the absorption. And I have run into practitioners who recommend doing it that way, and actually recommend like taking it with dinner, and then it's sort of slow release throughout the night. So, it's not a disaster to take it with food, but depending on which foods can kind of reduce your dose a little bit. You could be getting just a little bit less than the full dose that you're taking. And then what about Cytomel? That again is a really big topic. I use Cytomel sometimes, but it's an individual thing. It adds in a little bit of extra T3, and that can be really useful when someone has really elevated reverse T3 in the short term. I usually am not using it super long term. Once the person is out of that reverse T3 situation, we'll usually switch them over to a different thyroid formulation. But sometimes I'll use low doses long term if the conversion from T4 to T3 is just really struggling. So, okay. So I'm going to run over a little bit in time because we're getting close, but there's still a few things to discuss. So final thing with absorption, celiac disease is a major cause of malabsorption. And actually people with Hashimoto's are 5 times more likely to be diagnosed with celiac disease. So I frequently will test for celiac antibodies in anyone I'm treating who has Hashimoto's to just rule that out. So that's not a bad thing to check if you have Hashimoto's. And then, it can be helpful to add in some minerals. So we often will use concentrates, trace mineral drops, or nettle tea is nice as well. It's very rich in minerals. And then gluten intolerance is very common in people with Hashimoto's. So this is another just kind of potential root cause. Gluten can be a big problem with thyroid issues, and there's a strong association there. Even if you don't have celiac disease, there can still be a major gluten sensitivity. And so it's worth checking either via testing or via an elimination and challenge diet how you do with gluten and see if that's an issue for you. And one product that I kind of like, if not for celiac disease, with celiac disease, you should completely avoid gluten. But with gluten sensitivity, if it's not too severe and you know you might be exposed to a little bit, or, you know, things happen, you're on vacation, you have a piece of toast that's wheat bread or cake or something like that, Similase GFCF is an enzyme formula that's specifically designed to help you break down gluten and casein. So gluten from wheat and then casein from dairy. So that can be really helpful to take a little bit before and after you eat something with gluten in it. Okay, so basic self-care for the thyroid: eat a nutrient-dense diet, rule out celiac disease, and then avoid gluten if you have a sensitivity to it. I do recommend checking for celiac disease before you try an elimination and challenge diet on your own, because if you avoid gluten and find out you feel much better off of it, and then you want to check for celiac disease, you have to add the gluten back in for at least a month, eating at least a piece of bread every single day for a month, and then do the blood testing for celiac disease. And it's better to just do that first when you're already eating wheat to avoid that headache. If you're at the point of wanting to do an elimination diet, I would recommend at least 6 weeks of avoiding gluten, because it can cause such persistent and pernicious inflammation that it takes quite a long time for the inflammation to calm down. So you really have to avoid it for a pretty long period of time to really tell if it's helpful or not. The most important foods to consider avoiding with low thyroid function are gluten, dairy, and soy. Soy in large amounts can have a suppressive effect on the thyroid. So a little bit of tempeh or tofu here and there, not a problem, don't worry about it. But if you're vegetarian and you subsist on soy products, that could be. And then make sure you're getting plenty of minerals. Mineral-rich teas like nettle, red raspberry, and alfalfa teas are wonderful for this. And then a trace mineral supplement without iodine is generally really helpful. Make sure you're absorbing your minerals. So if you have acid reflux or other signs of digestive disturbances like bloating, frequent burping after meals, take that as a clue that you may not be absorbing your nutrients properly. And then manage stress, and that obviously is a huge topic, but meditation, really trying to make choices in your life that are supportive of your health and avoid overdoing it. Doing some therapy or trauma release work is so important. Tools that I use are emotional freedom technique, which is a tapping technique used to help your brain kind of reprocess and restore traumatic memories in a less triggering way. And then EMDR is a wonderful technique that some therapists are trained in for processing and working with trauma, as is internal family systems and brain spotting. So those are some of the best tools that I've come across for really helping to dig into and work with trauma and help get through blocks that might be present there. And then energetically, the thyroid is right in the throat, and it's kind of associated with this chakra that has to do with communication and speaking up about our needs. So I think sometimes that is a factor in people who have a thyroid disorder, and it can be really worth looking at and seeing if that resonates for you, and working on expressing your needs and asking for the support that you need. So with that, we'll wrap up the class, just a few minutes over time. If there's any more questions, I'm happy to answer those.
There is one question that's been in the chat. In response, asking about the cleanse, you had mentioned maybe doing a cleanse like the Revive 10-day cleanse. And the question is, should you blood test before the cleanse or after, or both?
Blood testing, I guess I'm not sure what we're testing for. Testing for toxins?
I think they meant the thyroid.
Oh, testing for the thyroid. Well, if you haven't ever had thyroid testing, I would do that first, and then also maybe 3 or 6 months later. So yeah, I mean, I don't think I've ever had anyone test before and after a 10-day cleanse just to check immediately. The way it's worked out is that I've had people, this doesn't happen all the time, but I have had someone complete the cleanse, and then, maybe 3 weeks later, they were starting to have hyperthyroid symptoms on a dose of thyroid that they had been totally stable on for years. And then we checked their levels, found that now they were too high on their thyroid hormone and had to lower the dose, which was really a wonderful thing. It's just you need to be looking out for these things when doing work on the liver. And yeah, so she did great once we lowered her dose of it. Oh, someone said spell that, please. And
I did.
wasn't. Oh, you did. Oh, great. Okay. I'm drinking rooibos tea. The enzyme to break down gluten. Oh yeah,
I wrote that down.
Wonderful. Anything else that you're seeing, Heidi?
I think Sheila had a question.
Yes, hi.
Hi.
So Dr. Wood, if we were to schedule an appointment with you, what would that, I know everyone's different, but like generally, what would that look like?
Yeah. So generally, it'd be an hour-long initial appointment. We would do a thorough history intake and just get the details of your particular situation, your history, your symptoms, order lab testing. Depending on the situation, I might recommend some other things as far as an initial plan, but sometimes, we just wait for the lab testing. And then generally we'd have a follow-up visit, usually 2 to 4 weeks later, 2 weeks if we're just waiting on the labs, 4 weeks if you're doing some treatments and we want to see how those are working. And then we'd have the follow-up, go over the lab testing, adjust from there as far as, whether there was thyroid hormone needed. And then oftentimes I'll follow up with people 4 to 6 weeks after that for a couple more to really make sure we're on a good track. And that really depends on what's going on. Did we do gut testing? Did we find gut infections? Like there's a lot of variability there. But does that kind of answer your question?
Yeah, if we're seeing a doctor, do you work with that doctor as
certainly
well, or is it?
Will. Yeah, if that is useful. I don't always, as a matter of course, reach out to them, but if the client or the patient asks that of me, I'm happy to. And then if the other doctor is open to that, absolutely. Yeah.
Thank you.
Of course.
And then the cost for telehealth appointments if insurance doesn't cover.
A new patient visit is $260, and then a follow-up appointment is $175. And that's for hour-long appointments. Sometimes if we're able to do a 30-minute appointment, then that would be, for a follow-up, that would be $87.50.
And then also I want to mention that for everyone tonight, there is a coupon code thyroid support. And if you make an appointment in the next week, you'll get $20 off your appointment. And then it's also can be used in our online store for 20% off of the thyroid support collection. And now all that information will be in the email that Dr. Wood sends out.
Yeah. And I'm going to send a handout that I made for another class that I teach called Introduction to Cleansing that does include the water filters that I recommend, as well as air filter recommendations and a few other things. So if you find the other things on there useful, great. Otherwise, you can just find the water filter info. All right, I think that's everything. Thank you so much. It's been great sharing all of this with you, and I really appreciate all the questions. So thanks for being here.
Thank you, Elizabeth, too.
Thank you so much, Dr. Wood and Heidi. It's always a pleasure working with you, and I know that everyone was super appreciative for your expertise tonight. So thanks for all you do in the community and your time tonight.
Oh, thank you. And yeah, we're so grateful for Marlene's for putting this on.
So thank you.
Right. Have a good night.
Thank you.